Hi, everyone. It's Jean Sachs, the CEO of Living Beyond Breast Cancer. Today, we are here to talk about a topic that I know is on everybody's mind, which is the FDA's recent recommendations of a third dose of the COVID-19 vaccine for people who are immune compromised. We know this is an important question for our community. So I'm really pleased that we have Dr. Mehta, a medical oncologist and member of our board of directors, who practices at MD Anderson Cancer Center at Cooper in Camden, as well as Holy Redeemer outside of Philadelphia. Dr. Mehta is going to help us understand the questions and how do we continue to live with uncertainty. So thank you for being with us today.
Thanks for having me, Jean.
Of course. So under the FDA recommendations, who in our breast cancer community would qualify for a third shot or a booster shot?
So as you know, about a week ago, this directive came out from the CDC that patients who are immunocompromised should get a booster. And over the last week, we've had several of the oncology societies and other organizations coming out with specifics on what that actually means. Because I think for our breast cancer patients, immunocompromised can mean patients on chemotherapy, patients who are getting radiation, patients who are getting targeted therapy. And who exactly fits that criteria actually to some extent will depend on your institution, because each institution does have specific guidelines. The CDC right now is leaving it as a bit, the recommendations are somewhat general, but each institution, so for example, MD Anderson, our recommendations are looking at patients who have who are getting chemotherapy or have gotten chemotherapy within the past year. We're also including patients who had radiation. Now, I can tell you other institutions, Memorial Sloan Kettering, for example, another big cancer institution, is looking at a 6-month time frame and is not including patients who receive radiation. So I think to some extent there will be some variation on the specific guidelines. So I would certainly make sure patients check with their oncologist and with their institution. I would also make sure that they keep their eyes and ears open, because I think what I'm telling you today may not be exactly what we're saying 5 days from now.
Right, we're getting used to that. But this is still for people who are 8 months out from their original second shot. Is that still the timing?
No. So this is for patients who are immunocompromised, the actual recommendation is you have to have had your second dose at least 4 weeks ago.
Oh.
So that's the current, the 8-month window appears to be for, potentially, again, no one knows for sure what the next few weeks hold, but for folks who, may fall under other categories in the non-immunocompromised. So at this point, if you've had a second dose and it's been at least 4 weeks and you're immunocompromised, then you're eligible for a booster.
Okay, and so you talk to your oncologist about that, or who qualifies
Yes.
you?
At this point, I think the best person to talk to, particularly because patients on immunosuppressive therapy are seeing their oncologists pretty regularly, and for the most part, they're seeing their medical oncologist. So really just having a conversation with your medical oncologist. Just this week alone, I think our center has received hundreds of calls on this. We've had very specific conversations with our triage nurses, our nurse practitioners, our infusion room team that often sees our patients even when they don't see us as oncologists. So the institution should have a pretty coherent, consistent message for the most part around this. So yeah, I would check with that team.
Okay, and I've read that the panic and the challenge that we had earlier in getting a vaccine should not happen this time, and that you'll have lots of places to go to. Right.
I think that's the one real difference this time, is that folks won't have to drive 3 hours to the middle of nowhere to get a shot. It is available. I think each pharmacy is also kind of still looking at exactly how they plan on administering these logistics. Some will require a note from from your oncologist. Others apparently won't. But I think checking with the pharmacy, checking with the team, most centers are already looking at just some documentation, a prescription perhaps to give to patients, for the shot. And some centers are actually offering the shot.
Got it. And if you received Pfizer, do you have to get the Pfizer for your third shot or Moderna, or can you get whatever's available?
So the recommendation by all the societies at this point is that whatever you received is what you should receive. And to be clear, Pfizer and Moderna are the ones at this point today on August 20th that are eligible for a third shot. So the Johnson & Johnson, if you've received that today, we're still not recommending a booster, but again, stay tuned on that.
Okay. So why do we need this third shot?
Yeah, it's a good question. So what we found over the past, I guess it's been 8 months now of vaccination and 8 months of data on breakthrough cases is that vaccinated individuals, and most of us have seen this on the news, and unfortunately a lot of us have seen this on our social media feeds, but when you look at breakthrough cases in vaccinated individuals, first of all, the risk of breakthrough cases, which primarily we're looking at hospitalized patients, the CDC initially tried to follow everyone with COVID, and what they realized is that there was this vast amount of underreporting that was going on for some people just because they were asymptomatic, but others just, symptoms were so minor that it wasn't being reported. So ultimately, around end of April or so, the CDC changed how it's tracking breakthrough cases, only looking at hospitalized cases and, of course, deaths from COVID. And, when you look at breakthrough numbers in vaccinated patients, the risk of being hospitalized a patient who is hospitalized, a patient who has been vaccinated, the likelihood of them being hospitalized with COVID is about 0.004%. And then the risk of dying is a fraction of that. So in other words, the likelihood is still incredibly low in vaccinated individuals, but when they looked at those, it was about 8,000 or so patients that were hospitalized of the 165 million that have been vaccinated. What they found is that immunocompromised patients actually made up a pretty large percentage of those patients. And for the last several months, even before vaccine, even as the vaccine was just coming out, there was data on what sort of immune response immunocompromised patients actually had to the vaccine. And what we found is for some, there was a diminished response. We were measuring it. Unfortunately, the only way we really could measure it is through these antibodies. But, antibodies are like the tip of the immunologic iceberg. And so immunity to vaccines depends on a lot of things other than just antibodies. But with antibody production, patients who had gotten chemotherapy, really their levels were a lot lower. Transplant patients, for example, were much lower. And so ultimately putting that all together and looking at hospitalized patients, it was determined that immunocompromised patients really do benefit. They also saw that from the first to the second dose, when you look at immunocompromised patients who develop antibodies, the first dose, it was a much lower amount. The second dose, they more than doubled their antibody response. So again, just kind of following that trend, third dose would have increased production even more.
Wow, this really shows that you have to understand the data and not just believe the news headlines. I think,
right.
And we're getting this in real time. So I think
right.
we all have to realize that we're learning. So just one other question, because we know many in the breast cancer community have kids under the age of 12, and that is putting an additional strain. So what are your thoughts about when those children might have the opportunity to be vaccinated?
Yeah, I think, at this point, we were hoping by the end of the summer we would have something from the FDA. There is some data out there showing significant benefit already with children under the age of 12. The important thing with younger children is that their likelihood, as we have seen now over the past year and a half, their likelihood of getting really sick from COVID is a lot lower than it is for, say, a 70-year-old. And so when the FDA is looking at the risk-benefit calculations, they have to take into account that the actual issue of COVID is less of an issue. And so the risk suddenly becomes a more important variable. And so we don't want children who otherwise may not have gotten ill anyway to be exposed and potentially have a side effect that we haven't quite figured out. So far, to be clear, it certainly looks like this is coming. We just don't have a exact date because particularly as the Delta variant's been the primary variant now that's emerged, we have to now look at that data in the context of some of the data that we have on the original variant and how does that factor in. We've seen that children are making up a little higher percentage of hospitalized COVID patients than we had seen, a year ago. Mm-hmm. So there's a lot of smart people looking at all this on an hourly, daily basis.
Right. Okay. So I think the message for those that are actively in treatment in the breast cancer community, that they should get their second dose if they're more than 4 weeks out from their second vaccine.
Third dose, yeah.
Third dose. I'm sorry.
Yes.
Third dose.
Yes. Hopefully they've gotten their second dose.
Okay. Yes. I have to get used to this third dose, but that's strong. That's what you're telling your patients.
Yeah. And I think the maybe even the message before that is get vaccinated.
Yeah.
I do have patients who throughout this have chosen not to for various reasons. And, I think it's important to have a conversation with your team. Mm-hmm. If it's a few conversations, just understanding, I think some of the concerns, no one wants to get sick and no one wants to be hospitalized with COVID and no one wants to die from COVID, particularly our patients, who already have gone through a life-threatening illness. Right. And, sometimes I understand the concern people have because they've already gotten these treatments, and sometimes there's a concern that there's another substance entering their bodies. But remember, this is a well-tested vaccine. There's nothing new about it. This research has been going on for over a decade, and it works. It works better than probably most of the vaccines we have. And it appears the risk benefit for the vast majority of people, it's worth it. Right.
Well, we agree with you, and I hope everyone gets their vaccine. So thank you so much, Dr. Mehta.
Sure.
And thank you for everyone who is watching and listening. Remember, visit lvbc.org for more information. If you need support, we have closed Facebook pages. So go onto our website and you can figure out how to join one of those pages as well as call our helpline. So thank you and take care.